Hi and welcome to video 4 of Student Nurse Bootcamp. I've been running errands since 8 o'clock this morning. It is now 4:30 and I'm tired and I'm worn out and I'm looking like rough, but that's okay. 3 basic principles that guide the nursing practice, or that will help you learn how to prioritize situations, what patients to take first, things you're going to be looking at during assessments and such. This is going to help you with NCLEX questions. This is going to help you on your exams. This is going to help you back in the lab. These are going to help you in the clinical setting. You will use these not only every day as an RN, you're going to use these every day as a nursing student. So these concepts and principles are going to be covered initially with you, and it's going to be over a long lecture or even a couple of days, but I went through all of my notes. I wish you could see my table. It's a hot mess. But I go through and I find the core parts of it and I rewrite my notes, and with one of them I'm using my actual notes that I rewrote after class one day, and I'm just going to read from them because it's important for me not to forget something. It's important for me to explain it correctly to you all. So if you just bear with me, we're going to go through 3 basic principles. The first principle is your ABCs. Your airway, breathing, and circulation. This is most important above anything else. Of course, you're going to help someone who's having breathing problems before you have before you can address circulation, etc. So the ABCs is, like I said, airway, breathing, and circulation. And airway also includes even maintenance of an artificial airway. That's first, okay? Your second principle to help you prioritize maybe what patients to take first, or what you're going to be doing with each patient, there's an order of importance, and this is called Maslow's Hierarchy of Needs. And I went to my scrapbooking room and I just got some scratch paper for you visual learners because I'm a visual learner. So I just thought while I was reading I would hold this up and kind of point in things. So Abraham Maslow has a doctorate in psychology, and back in 1968 he came up with a way to identify one's needs at any given time, kind of in order, not kind of, in order of importance. And these are his basic principles and findings. So this will help you evaluate, prioritize, and such. Okay, you probably also remember this from human development or sociology or psychology. Well, it's coming back and it's here to stay. So let's go over this again for some of you that maybe don't remember. Okay, so this kind of reminds me of the food group pyramid, and I want you to think of it as such. The largest portion on the bottom is the most important, and that's what we would address first. These are your physiological needs, the needs for your body. You need these things in order to live, all right? And they are oxygen, temperature control, food, elimination of your bodily wastes. So we're talking urine and poo-poo. Sexuality, physical activity, and rest. Okay, some of you might disagree with 1 or 2 of those, but for the most part, I mean, these are it. These are what you need to survive. They must be minimally met in order for you to maintain life. If one is missing, it could cause illness, and if it's given back, it could restore your health. And often the major part of nursing care, of your nursing care plan, is, especially with the very young or the very old, disabled, or the ones that can't do these or perform these for themselves, is for you to make sure that these needs are met every day, all the time. Okay. The next one is safety and security. So there's physical components of safety and security, and then there's emotional components of safety and security. So I'm going to read off the physical components first. Hand hygiene, using electrical equipment properly, administering meds knowledgeably, using skill with moving and ambulating patients. Okay, that's the physical part of safety. The emotional components are trusting others. They need to feel free of fear, anxiety, and apprehension, Patients and families fear the unknown, and so they may have significant emotional security needs. And you want to encourage their spiritual and practices, and maybe they believe in prayer, maybe they believe in a ritual or something. You need to encourage that because that gives them a sense of comfort, okay, and a source of strength and support. Need to allow as much independent decision making and control as possible, carefully explaining new and unfamiliar procedures and treatments. Okay, so when you educate, that takes a lot of fear away because it's fear of the unknown. Now, both of these I just covered are called lower level needs, but in no way do I want you, and this is where I got mixed up when we were just getting it in lecture. So in my mind, I switched it around. I thought, oh, lower level, that's less. No, it's the most important. It's the highest priority. Okay, so these two are your lower level needs. They're bigger, so think of them as being most important. And you see my arrow going up. The last three are known as the higher level needs. So you meet these first, and then these can be met. It's hard to meet these without these. Okay, so think of it like that. Okay, so our third one is love and belonging. Relationships with others, communication with others, support systems, feeling like they're a part of a community, and feeling loved by others. If unmet, they can feel isolated and lonely, may withdraw physically and emotionally, or they may become overly critical and demanding. Okay, so this might also be not only patients, but their families, okay? Nurses should always consider love and belonging needs when developing a plan of care. Include the family and friends in the care of the patient. Establish a nurse-patient relationship based on mutual understanding and trust. Very important. And refer to patient-specific support groups if they need certain things later on after they leave you to help keep them on the path of feeling good, okay? Number 4, self-esteem. Okay, so this is kind of like emotional. They need to feel good about themselves, need to feel pride and a sense of accomplishment, want others to respect and appreciate and recognize those accomplishments. When a life role changes due to a loss of a job, death of a loved one, a big move, self-esteem can really take a hit. Okay, this includes change in body image as well. So a big weight loss or a big weight gain, loss of hair, loss of a limb maybe, or growth spurts really early or really late. These things can really alter their self-esteem. So as nurses, we need to understand to not only think about those things, we need to concentrate on their strengths, okay? Really point out to them what they're good at so you can really build them up that way. Concentrate on strengths is very important. And you need to remember, I wrote this down because I thought it was very good during lecture. Remember the person's perception of the change rather than the actual change. It's what affects their self-esteem. I thought that was, oh, my phone. Sorry, someone's texting me and it made my phone vibrate and move. Okay, so I apologize, my goodness. All right, so last one of this one. The very tippy top of this pyramid is this pink part. This is self-actualization, learning, thinking, decision-making, values, beliefs, fulfillment, and helping others. The nurse should focus on patient strengths and possibilities rather than the problems. They should provide teaching to help maximize these potentials regarding their clients, patients, whatever. So that is Maslow's hierarchy of needs. So after, if you're reading test questions or whatever, so after your ABCs are addressed, well, some of your airways addressed in here, oxygen is a basic need of life. So, you know, if nothing is really having to do with your ABCs, then start with your Maslow hierarchy of needs. Physiological needs, safety and security, love and belonging, self-esteem, and then self-actualization. Okay, So remember Maslow's hierarchy of needs, very, very important. And it was kind of confusing and hard at first for some of us, but you start using it every day and it's really kind of weird because now you kind of, you use it in real life as well. So what may not be significant to you, you're like, why is my teenager over exaggerating about this? It's very important to them. Okay, so it kind of helps out with that. Last component is what we call, well, every school has different acronyms or what, but we used ADPIE, A-D-P-I-E. And that stands for assessment, diagnosis. It's also called analyzing, planning your care, implementing the care, and then evaluating the care. So this is how I wrote my notes. I know a lot of you really, really want to know how, because I'm a color person, so this is how I did assessment. I kind of did this on a break in class because it was being thrown at us a little bit, so I needed to break it down. So please forgive me, but I am going to read quickly because I don't want to look over something. So first step is assessment, A for ADPIE. The definition, it's a systematic process of collecting, organizing, validating, and documenting data, which is information about the health status of an individual and their family, group, or community. All phases rely on accurate and complete data. And you can't really go down to the next step. Each step relies heavily on the step prior. So you need to be thorough with each step. Okay, so the purpose of the assessment is to establish a database about the client's health status, ability to manage their own care, and need for nursing. The plan individualizes holistic care that draws on the patient's strengths and responsive to changes in the patient's conditions. Okay, so activities is establish the database. So you're obtaining nursing health history, you're going to conduct a physical assessment, you're going to review the patient's records and the nursing literature, consult patient support system and healthcare professionals. You're going to continuously update the data, organize the data, validate it, and then you're going to communicate not only with the patient, but with others, maybe the doctor, maybe physical therapy or respiratory, their CNA, your LPNs. Everybody is a team with this. All right. This is also where I've talked about objective data and subjective data. Subjective data is kind of what's given to you from the patient and their family. It's things that how he's feeling and what they say about how he's been acting or feeling or complaining about whatever. Objective data is the test results, is your assessment, the vital signs, the chest x-ray, etc. It's the don't argue with, it's not subjective, it's hardcore, it's concrete data. Okay, I wrote on my hand earlier, very bad, don't do that. That was step one. Step two is diagnosing now, also called analyzing, but it's the D in ADPIE. So this involves critical analysis and interpretation of assessment data, identifies actual or potential health problems, risks and strengths of the patient that nursing intervention can prevent or resolve, and it formulates a nursing diagnosis. So the purpose of this is to develop a list of nursing diagnoses prioritized, okay? You're going to identify the patient's strengths and healthcare problems that can be prevented or resolved by both collaborative and independent nursing interventions. Collaborative meaning with other people, like I said, the PT, the OT, the respiratory, the doctor, and then independent nursing, the nursing you're going to do with your patient. Okay, so activities, you're going to interpret or analyze the data that you just collected during your assessment. You're going to compare against standards. You're going to identify gaps and inconsistencies. You're going to identify strengths and health problems or risks, their health risks. And then you're going to formulate a prioritized list of nursing diagnosis and collaboration problems. Document nursing diagnosis on the care plan. Okay, again, I know most of this is probably overwhelming, but it's going to be talked about all the time. So I promise you, the more you see it and hear it and read it and listen to this video again, because this is the meat and potatoes of it all, the more you'll understand it. You're going to get a more drawn out lecture about it with more detail and more examples, but I didn't want to, I can't do a 6-hour video, so mine are long enough. Okay, the PIE is for planning. All right, so this is our third step. This is the outcome identification. So the description is to determine how to prevent, reduce, or resolve the identified patient's problems, how to support patient strengths, how to implement nursing interventions in an organized and individualized and goal-directed manner. I got all this, by the way, from a combination of sources from our lectures, my notes, and texts. All right. The purpose of this is to develop an individualized care plan that specifies patients' goals and their desired outcomes and related nursing interventions. So the activities are, you're going to establish the priorities. You're going to prioritize the problems for the most important to the least important. So think of your Maslow hierarchy of needs. Think of your ABCs. That's what you're going to use to do this part. You're going to write goals and desired outcomes. You're going to select nursing interventions to achieve those goals. You're going to consult with other healthcare professionals, such as, again, occupational therapy, respiratory therapy, the lab, whatever. You're going to write nursing orders and care plan, and you're going to communicate the plan of care to the patient and to the other providers. All right? That's planning. Our fourth out of fifth step is implementing. This is the I. Description is nursing care plan is put into action. May also be called intervention. It consists of carrying out or delegating nursing interventions. Delegating is assigning care for a patient to another individual while retaining accountability. So even though you're doling out, could you please do this for the patient, you're still accountable for that care. And the purpose to assist the patient to achieve the following: their desired outcomes, promote wellness, prevent disease and illness, restore their health as best as can be done, and facilitate coping with altered functioning. All right. So that could be if they need to use a wheelchair now or for a while, or they need assistance. A lot of people have troubles with that. They feel like they're not whole anymore. And whether it's temporary or permanent, that's where, again, we get our support groups going and get them the help they need in the self-actualization and love and belonging and self-esteem parts of the Maslow hierarchy. So activities are to carry out the plan of care. You're going to continue to collect data. You're going to modify the plan of care as needed. Document the care and the patient's responses to that care. And you're going to give verbal reports as necessary. All right, the last step is evaluating, the E in ADPIE. The description is, it compares the patient's response to the outcome goals to determine whether or to what degree goals have been met. Based on evaluation, the care plan is either continued, it's modified, which means changed and tweaked a little bit, or it's terminated, possibly because goals have been met. Oh, I think I just covered this. Okay, so ongoing, it's done while or immediately after carrying out nursing interventions. Intermittent is performed at specific intervals, for example, 2 times a week, 3 times a day, things like that. And terminal is performed to indicate patient's condition at the time of discharge. So the purpose of evaluating is to determine whether to, again, continue the care the way it's going, to modify that care, increase something, take something away, alter something, or to terminate that part of the care because the goals have been met. Now the activities are to measure how well the patient has achieved desired outcomes, identify factors that contribute to the success or failure, review and modify care plan as indicated or terminate nursing care, document achievements of outcomes and modification of the care plan. Document, document, document. Everything is so important. You document everything. Okay. Now, with assessments, there's 4 different types of assessments. And even though those are the 3 basic principles, the first thing you do with this last part of the ADPIE is the assessment. So let me break down the different types. The first one is the initial comprehensive assessment, and that is performed shortly after admittance to the healthcare facility. It's performed to establish complete database for the problem identification in the care plan, performed by the nurse to collect data on all aspects of the client's health. A focused assessment is initial assessment, follow-up, or ongoing data collection. It gathers data for a specific problem, new or overlooked problems, performed by the nurse to collect data about a specific problem. So any of those. An emergency assessment is performed when physiologic, your body, or psychological, your mind, if a crisis presents itself. It's performed to identify life-threatening problems, performed by a nurse to gather data about the life-threatening problems. So in your initial assessment, if someone's coming in and, you know, it's not dire, you might skip a few steps and just get to the meat of it. If their life is in danger, you need to address things a little differently. And our last type of assessment is a time-lapsed assessment, kind of like an update or a follow-up. It's performed to compare patients' current status to the baseline data obtained earlier, whether it was like, oh, come back and see me in 6 months, or come back in 2 weeks, or come back tomorrow. That is a time lapse. It's an update or a follow-up. It's performed to reassess health status and make necessary revisions in the plan of care, and it's performed by the nurse to collect data about current health status of the patient. Okay, so I'm sorry this one was a little dry, but it's very important. It's, again, something you will be tested on often, so get to know these. Your ABCs, Maslow's hierarchy of needs, that pyramid diagram I explained to you, and ADPIE. Some people, I guess I heard of SOAP and SOAPy, not quite sure what the, wait, did I write that down? Maybe someone used that at one time. I did, hold on, it fell. On an older nursing, they no longer have the videos up, but someone mentioned SOAP, and that's subjective data, objective data, assessment, and planning. And then the SOAPy adds on the I is implementation and evaluation. So, yes, that is it for for this video. So, comment, rate, and subscribe. Let me know. I know there's a lot more. Well, there's a couple more videos coming up. I am addressing things you guys want to see. By no means am I an instructor. By no means am I saying it's written in concrete. I'm giving you what I've learned. I'm giving you what I've gone through, and I'm giving you what I feel could help you in the beginnings of your, with your first semester. You're getting your feet wet. I just feel with these nurse boot camp videos, I'm giving you the basis so that you're a little more confident and comfortable and not so overwhelmed in the beginning. So I appreciate all comments, and I will talk to you all later. Have a good night. Bye.